Hello, ladies and gentlemen. I'm very honored to give this speech. My name is Mao Qiufang, and I come from South-Outlet Hospital of Xinjiang, China. My research direction is prevalence and risk factors of lower urinary tract symptoms in children and adolescents in Mainland China. The content of my report is mainly divided into the following 5 parts. The first part, research purpose. The aim of present study was to investigate the prevalence of lower urinary tract symptoms and their risk factors in children and adolescents in Mainland China. The second part, materials and methods. The research is a survey research. A total of 5 primary and middle schools in Henan, China were randomly selected. The online and offline simultaneous survey were performed. A total of 4,000 anonymous questionnaires were distributed, and 35 divided questionnaires were finally collected. And the method of training first serving later is adopted to ensure the quality of effective questionnaires. Scientific use part version 25 for data analysis. T-square test is used to compare statistics. P less than 0.05 was considered statistically significant. The third part of results, the prevalence of urine organ of 14.18%, frequent 8.29%, LUTS 4.68%, and nocturia neurosis 2.96%. The prevalence of UTI is 15.62%. The prevalence of frequent urination and organs together at the same time was 6.07%. The prevalence of frequent urination, organs, and LUTS together at the same time was 1.75%. Frequent urination, organs, LUTS, and nocturia appearing simultaneously in 0.39%. The statistics of the proportion of children of different ages are shown in Figure 2. The 6-year children with at least one LUTS and 35.21%, and the prevalence of 16 years old children with LUTS dropped to 10.29%. As shown in Table 1, diapers used last for more than 1 year and began voiding training after 1 year old. Urinary tract infection. Refuse tolerant training showing a significant impact on the prevalence of LUTS. The first part, interpretation. With the increase of economic level, the use of diapers has increased, and the daily of TT has led to LUTS increase significantly in children and adolescents. And the younger the age, the higher the prevalence of LUTS, and the care of children with LUTS should be paid more attention to. School-age children suffer from LUTS was found to be as high 35.21%, and therefore more attention should be paid to the healthy care of those children. The 15th part, conclusions. With diaper for more than 1 year after birth, UTI and no TT are risk factors for LUTS, and initiated TT before 1 year old is a protective factor for LUTS. My report is over. Thank you for your listening.